Well, new this evening, a request to taxpayers. This November, Franklin County voters could be asked to keep funding a project already years in the making, the new Franklin County Crisis Care Center. That facility, designed to be a lifeline for those in mental health or addiction crises, has already cost taxpayers millions of dollars to build.
But now a new ask to cover the ongoing services inside. Tonight, I find out how much more this could cost you and why those in recovery say the cost of inaction is far greater.
8 years sober last Wednesday.
For Patrick Jackson, it took him 35 years to proudly say those words. He started drinking at 14.
I ended up going to AA, is what my brothers had suggested, and I did that and did 3 meetings my first day. It was very emotional, and it was what I needed to survive.
And for Amy Burke-Donnellan.
So September the 18th of 2016, I will have 9 years.
Congratulations. Does it feel good to say those words?
Oh my gosh. I can't believe it's my life.
She says a life of addiction can happen to anyone.
It did for me. And I lost my job, my career, my home, marriage, child.
Jackson detoxed on his own, but Donnellan says an inpatient facility in Columbus saved her life. The peer connection, something she says hospital emergency rooms don't provide.
Number one, being the education of the counselors and therapists and the nurses. I mean, that really is, the doctors come together and they work on what's causing this problem and, what was your triggers.
Currently, more than 30,000 mental health crises are treated annually in Franklin County emergency rooms, a burden on hospitals and first responders alike. To offset that pressure, a new $60 million Franklin County Crisis Center opening this summer will provide a wide range of recovery, clinical, and medical services all in one place. The facility was paid partly by taxpayer dollars and other donations, but now the Alcohol, Drug, and Mental Health Board of Franklin County is asking taxpayers for more money.
This isn't just a request. It is a critical investment in the well-being of our entire community.
Tuesday, Adam H. proposed a 10-year, $2.85 million renewal with a small increase. For the average homeowner, that's about $69 a year per $100,000 of a home's value. That's roughly $17 more than the current rate. Adam H. says the need is urgent, with anxiety, addiction, and depression still on the rise.
And these funds are the lifeblood for services delivered by over 50 community-based behavioral health providers.
Jackson says if the funds aren't allocated now, the people of Franklin County will continue to pay in other ways.
I know there's a huge cost, but there's also the big cost on the back end, to the healthcare system, but also if somebody does kill themselves, et cetera, then, it affects families, friends.
Having that crisis care where they can get right in and get in there, I think it's just imperative people getting help.